Pain. It is the primary reason we see a doctor. For physicians, treating pain is at the heart of the covenant with each patient.
I think we who are doctors, nurses, healthcare professionals actually have a professional obligation to assess and evaluate pain precisely because it can cause so much human suffering if not treated properly.
Today, we have powerful medications to treat debilitating chronic and terminal pain. But because of the occasional high-profile case of a doctor being charged or sanctioned for prescribing powerful controlled substances, physicians hesitate to prescribe these medications for fear of scrutiny by law enforcement. At the same time, law enforcement is striving to keep controlled substances off the street. We face two realities. The undertreatment of pain is a major public health problem, but so is the abuse of prescription drugs. As a society, we must address both of these issues at the same time. All too often, patients get caught in the middle and suffer the consequences.
I'm thinking about people who literally have been crawling on the floor asking for better pain relief because they were either denied pain medications by a doctor or were so afraid to take the pain medications because of exaggerated fears that they would become addicts and out of control in their lives. So there are actually many stories like that.
For more than a decade, the Center for Practical Bioethics has sought solutions to this problem by serving as a forum for physicians, patient advocates, and law enforcement to discuss this issue, including work with the Federation of State Medical Boards and the National Association of Attorneys General.
In the late 90s, they recognized this problem, the undertreatment of pain, as a significant issue and took some real leadership there. And we were very pleased that they reached out to the center and asked for our help. At that time, we were directing a national program for the Robert Wood Johnson Foundation, and were working with statewide coalitions across the country, and the undertreatment of pain was part of that program. So it was sort of a natural partnership, a natural working relationship.
I was attending a meeting with my wife, Linda, the medical social worker, where Myra Christopher was speaking. And she talked about the dichotomy between what people hope for at their end of life and what's actually happening. And as Attorney General, I was trying to figure out what are the barriers between what people are looking for and what actually happens in the real world. So when I became president of the National Association of Attorneys General, we had a series of listening conferences across the nation. We invited attorneys general to listen to medical people, to nurses, to ethicists, and to consumers of health care at the end of life and who have had family members go through that experience. I wanted to put this issue on the radar screens of attorneys general across the nation, and we did that.
In 2006, a national task force led by the center began research into the impact of law enforcement on the treatment of pain.
One of the things that the group we brought together in the summer of '06 thought would be really helpful was if we could get some data with regard to physicians, specifically physicians who were being investigated, and by whom and why and what happened as a consequence of those investigations. And the results were really quite interesting because, number one, it is very, very unusual for a physician to have charges brought against him or her. Our doctors are very responsible people, but the end result was that it was 0.1% of all practicing physicians in the United States.
But when a doctor is charged with drug-related offenses, and that charge is highly publicized, there is a chilling effect on other doctors' willingness to prescribe controlled substances. To address this problem, the center led the national effort to develop a template to help guide law enforcement in understanding the complexity of pain medicine and to assure physicians that, if investigated, they will be treated fairly. The Center's critically acclaimed policy brief has been circulated across the region and the country.
These cases can be very complicated and very complex, even for healthcare professionals to understand. It's not the expertise or knowledge of law enforcement, and so we believe that it would be very helpful for them to have resources.
The goal is to improve working relationships between medicine and law for the benefit of patients in pain.
Understanding that the roles that they play as law enforcement may have unintended consequences in the medical arena, so being more sensitive to that and engaging healthcare professionals in conversations that would reduce those unintended consequences. And the Center has been upfront in that.
While much has been accomplished, much remains to be done. The Center for Practical Bioethics will continue to serve as an impartial and respected convener for law and medicine to reach the goal of a balanced pain policy.
Jack Schwartz, Assistant Attorney General in the state of Maryland, who attended all of our listening conferences, told the collective AGs that if at the end of your term you can say that because of your work the level of human suffering is less than it was before, no matter what else you do as Attorney General, you can count your term a success.
Ethics often is a bridge, provides a bridge across which people can walk when they really think that they've become adversaries. And if we can help people focus on their common values, what they have in common and what their goals are, and to work towards that, that it's easier sometimes than if you're focused on what you disagree about.
We need really good ethical thinking, moral thinking about how we're making these decisions and what are the policy implications in terms of their effects on real people and on real practitioners. And the Center for Practical Bioethics has really historically done a great job in that. And I think their guidance on these ethical issues that will surround these policies is going to be even more critical.